that one?
You can sit wherever you want.
Okay, good. That's packed.
Hello. This will be fun. Okay, so 5 great panelists. I won't read the title because it's quite heavy and long, to be honest. But actually the highlight is on spoiled customers. Well, at first place, at least my wife says that I'm a spoiled customer. I would rather say that I'm a nice customer or demanding. So at first place, let's introduce to each other, and maybe we can start with you, Arantxa, and maybe you can also say for yourself, are you a spoiled customer?
So Arantxa, you've seen me 20 minutes ago, so I won't introduce myself again. I am a very spoiled customer, but
Welcome to the club.
That's it? Okay, then that's it? I am.
Good morning, everyone. My name is Ksenia Levina. I'm the Global Customer Experience Lead at Grünenthal. I'm passionate about CX and making it to work in practice and to build connections between customer experience, marketing, and omnichannel. And typically I have a different voice, so please bear with me today. I don't think that I'm really spoiled customer, so probably because my bar in terms of expectations is high.
Exactly.
Setting the bar high indeed. So Dirk, Abeel, Global Head, Customer Success Management and Go-to-Market at Pitcher, Sales Enablement. I wouldn't say I'm a spoiled customer. I consider myself more like a delighted customer.
I use that word as well.
Very good. Hi, everyone. My name is Lin Lei. I am coming to you from Danone, the yogurt company. But we also have a very big business within specialized nutrition, so that's why I'm here. I join you as the global head of HCP engagement. So I would say I'm an extremely spoiled customer, rather, I would like to think of myself as an extremely spoiled customer because I have very high expectations from the brands, from the services that I'm engaging in. Am I a happy customer? Not per se all the time, but that's to come. Yeah.
Fair enough. And Haider?
So it depends on the industry or the product I'm buying. So if you talk about sports car, yeah, I think, that could be considered a delighted customer. If you talk about banking and healthcare, not so much.
Okay. Yeah. So the expectations are very low.
Exactly.
Okay, so speaking about spoiled customers, we hear it very often, Netflix, Apple, Google, Amazon, Pharma has to be like those great and sexy brands. But is that model even applicable in Pharma, or do we have to reinvent our model? Maybe we can start with you, Dirk, because I believe you hear it on a daily basis from different pharma companies. We would like to be the next Netflix when it comes to customer engagements.
It's an interesting question because for me it's creating the wrong expectations. The Amazon-like experience, etc. We can definitely learn a lot from these companies, that's clear. Do we need to mimic what they are doing? No, because their business model and what they want to achieve is completely different of what the pharmaceutical industry is striving for. And especially in the last couple of years where we are really focusing a lot more on delivering quality, sustainability, transparency and trust. We've been hearing about it, all the bad movies about the bad guys.
I never watched them.
Yeah, exactly. So I think we are inflicting a bit this conflict ourselves by talking about we should deliver a similar kind of experience. I think we have to say no, we are not going to deliver such an experience. And the reason, explaining the reason why, because it's about something completely different. It's about patients. It's about making a difference in quality of life and expectations. So by setting that bar a bit lower, I think we can manage already a bit better the expectations. So let's put expectations at the right level, I would say.
Fully agree. Let's move to the left, and I see Ksenia would like to add on that.
I just wanted to build on that point about expectations. There is a saying that the best experience customers, the best last experience customers had anywhere becomes the minimum expectation for the experience they want everywhere. So from my perspective, do we want it or not, the bar in terms of CX is elevated. And the question is, should we consider ourselves like in that race versus those companies that Amazon and others, or not, or we shall have our own way? From my perspective, that some of the customer expectations, it's by default for us difficult to address because we play in the highly regulated industry. At the same time, I think we are in the position to address others and, for instance, to provide customers with seamless, personalized, and high value-adding experience. The question is where we are towards that aspiration.
Fully agree. Arantxa?
Yeah, I'm going to probably bring a slightly different point of view. I think the difference between the Amazons and Netflix and us is, in our case, as innovative pharmaceutical industries, if you look into our value chain, we do bring the core customer experience, which is delivering medicines that make life for patients better. That's our core, right? Here we're talking about where are we in the game of, let's say our promotional medical efforts so that we can achieve that ultimate goal, right? So it would be unfair for somebody to judge us compared to innovation in the core of our business versus in how we deliver, right? That. So I would say I don't think we can compete at that level, but I still think we have to move towards improving that experience substantially, right? I still think that in the core of our business, we're at that level. We develop medicines that make life better. That's hugely powerful. But how can we make our business leaders understand that, especially after the great slides that we had on like 40 to 70% of people care more about the experience than the product? How can we level up our game on that end, right? But I still think that it'd be unfair to say we're not there, because in the core of our business, we're probably the most innovative industry in the world. But how can we level up the other side, right? So that's a bit, I think, where's the disconnect and where we need to, move our leaders towards.
Thank you, Arantxa. Lynn?
I think it's an interesting perspective. I think the idea around, looking at the top players within CX, it's good, but I think we should rather look at the needs of our customers as a cornerstone of how we design our interactions. Like, what is the HCP expecting of us, and how is his expectations changing, and how can we then adapt to that? I think that's because we could never be, I'm gonna be the Netflix of pharma. I don't think that's really our goal here. I think it's really about, figuring out how we can continuously improve our own customer engagement based on the needs of our healthcare professionals, because they are changing. And I think, now we know that millennials make up of the largest population that we are seeing in terms of engagement. So how is that engagement model gonna be looking at, 10 years from now? Are we still going to be looking into how can we deliver the best customer experience with our sales reps or with our digital engagements? Or in 10 years, are we going to have to detail to AI? Because there's going to be AI systems that's going to be, prescribing products to our patients. So I think it's more about keeping an eye on the trends and the future developments of where the demand is going to come from, rather than chasing some of these more easily attainable customer experience stars in the group.
Thank you, Lynn. And I left you actually with intention for the last, because you have also some additional perspectives, right?
Yeah, I will not make friends here. I will slightly disagree with all my colleagues here. For good reasons. So it's a conversation,
Of course.
right?
Obviously.
I'll start with Dirk. So I think we should strive to exceed. So when you ship a tech product, if you ship it 10 times better in terms of UX, then I think that's the level of expectation you should always do. If you come to, and I see the world a bit differently, maybe it's just me, but I see websites and phones like a square of pixels, right? It's like, how many square pixels am I optimizing? And right now, if you look at the world like that, the money spent per pixel, you have huge companies like Netflix, Spotify that invested a ton of VC money in human factor studies. So the cost for us industry to leapfrog to a status of experience that is not so bad, just bare minimum of, I don't know, like you see those blog posts on Think with Google. I like this blog, yeah, right? You go to Think with Google and you see the UX material design. They are school of thought, right, on UX. I think we owe to the customers to do the minimum of just catching up, and you don't have to spend that VC money. I think you should just pressure your agencies who work with you to level up. I think that you said something that I like, is that also the users of those experiences of today are not the one we should thrive for, even if they exist. But I think what we develop today is like an R&D pipeline. We should know that the human factor studies we will do in 5 years will be people educated by those interfaces, and we'll have to deal with that. And if you don't start now, it's too late in 5 years. And also there was another point that someone made, I don't remember now, but it is regarding the, I lost my point now. It is regarding the quality of the expectation, right? So that you put up. It's it's modular. So if you have a problem right now, you need to find the SMPC of a drug because you don't know if you can give it to your kids. Your level of expectation from a CX is very low. You just want the information. When you are chasing solutions, comparing, now it's becoming more important. I think also you need to modulate that experiences, and context is important. I just wanted to highlight that.
Okay, fair enough. Next question. What are actually the missing pieces, capabilities, and touch points which we have to implement for better customer experience? Maybe we can start with you, and then we will judge you.
Yeah.
So what are the missing pieces, capabilities, and touch points which we have to implement for better customer experience? What you also see from other industries, because you have this wide angle from other industries.
Yeah. I would say, yes, I work with banks and fintech, and I see that what Revolut did is interesting. They didn't have a bank license, they used other banks, but they started something very small and they shipped product every week. Iteration. Know your customer, the KYC, was not just a banking thing, it was, oh, I have 20% of people who prefer to click here, so I'm going to test it for 6 weeks. And I think that's a relevance of being in that industry. And there are new people coming from tech that comes into pharma now that have that mindset. So I would say iterate, trust the data, have a bit of a gut feeling and move on, yeah.
Makes sense. Dirk?
Iteration, definitely. I fully agree with that. And I also believe that we will have to do a lot more effort in genuinely involving for whom it is designed. So being it physicians, being it patients, so really involving them from the thinking process to the application. Because it's by bringing them on board that you will find out a lot of things you have never thought about. And that's also part of the extended kind of iteration process. And I see left and right certain initiatives popping up, but it's very, very small. So I think we should really accelerate there, because that could really propel us to a new kind of era. And linking it back to the first question, to create really a unified, not a unified, a unique experience to customers and their patients. So it's closing also that kind of loop, I think we should work on. And iteration, obviously, and automation behind is a critical step in that. Yeah, fully agree.
Let's continue with you, Ksenia, and I know you're very passionate about touch points in particular.
And in general, customer journey. Maybe also connecting the line on the iterations. From my perspective, one of the capabilities that we still need to invest into building in pharma is understanding and proactively managing the customer journey. And it's one of the key capabilities those CX leaders that we typically refer to, like Amazon, etc., built to become customer-centric. And this includes truly understanding the customer, their needs, and emphasizing and understanding the journey, becoming better as the listening organizations and effectively gather, analyze, and disseminate customer feedback to improve experience. And the last but not least, to actually act on customer feedback. There is a very striking statistics available that says that the majority of the companies collect customer feedback, but only 10%, can you imagine, only 10% of the companies are actually acting on the feedback. So from my perspective, it's better not to ask for feedback at all rather than to do nothing with that, because customers invest their time, their effort in sharing their perceptions, feelings, etc. on the experience. And if you do nothing with that, it creates even worse experience for them. So from my perspective, it's also about iterations, because when you listen to the customers, you understand what are the problems, and then you implement improvements, and you iterate to continuously evolve the customer journey.
That's very interesting. Arantxa, I see your...
Yeah, I think on this one we're all going to be on the same page. I think I talked about a lot about, not that much, iteration, but, gradual improvements, right? Like for pharma to be okay to test MVPs. I think we don't need a finished product that we just let go and never look at again, right? I think that's a critical one. The two things that will enable that, I think, Ksenia, you did a great job, is analytics. I think we still need to invest a lot in analytics, not just about quantity, but about the quality. And how do we connect the dots? I think we're very good at collecting a lot of data, but not so good at connecting that data and making it actionable. That's a key one. And then, as I said, for me, having a lean organization, because then where we are also as pharma, we're very slow. So even then, if we have the aha moment, we may take 6 months to turn that around, right? So how can we build safe, agile, fast working teams to execute on that fast? Because fast, looking at this fast evolving environment, that's critical, like the speed of turning those, qualitative improvements around, yeah.
Yep.
And Lynn?
I come with a bit of a different perspective. I think when I look back at my own career, and I've been working in digital transformation for all of my career, it's really like my pain point. It's really around, investment and money really makes it happen, right? So if you're in an organization that don't truly believe in CX, because that's what we're talking about, how can we improve CX? What kind of capabilities do we need to build? Well, there's so many capabilities we need to build within my current organization, right? From data, cleaning up the data lakes, connecting our ecosystem, fixing the processes, because processes is really about how you make things happen, and fixing the culture, the mindset, etc. But all of that wouldn't come to life if we don't have senior leaderships that are actually buying in to the need of transforming. So I think for me, one of the biggest bottlenecks in my life on this transformation journey is getting to those leaders within the organization where you can see you can move the needle just a little bit. They have a little bit of a spark in their eyes when you talk to them about CX. And if you can get those people on board and make sure that you continuously deliver on what you promise them, I think that is going to help you a lot in your transformation journey towards better CX for your customer.
Absolutely.
I would like to add one thing. And I've been on both sides, the customer side and the vendor side. I would also say leverage your vendors a lot more, because your vendors are sitting on a pile of data, directly or indirectly, across many industries. So also there to leverage that, but that also means that the relationship between vendor and their customers should become a lot more a transparent and a trusted kind of partnership. So that's a call I want to do here as well. Is start looking at your vendors not only as someone who's providing technology, now they can give you also a lot of insights, which could be leveraged for the good at the end of the day.
Absolutely. Let's speak about measuring customer experience. Absolutely a very critical theme. So what might be the key KPIs or potential KPIs or dashboards or analytics which we should put in place when it comes to reacting and being proactive when it comes to customer experience? Who would like to start first with that one? I won't pick anyone. Please.
Okay. From my perspective, the customer experience measurement can be as sophisticated as we want, and to include beyond voice of the customer, voice of the employee, and voice of the process. I believe that the fundamental piece is listening to customers and acting on their feedback. And for that, we need to have in place, first of all, right metrics. And here what I mean is measuring not only individual touch points, but the entire journey. And also going beyond the standard metrics like CSAT, NPS, or effort score. And for instance, measuring how well we deliver against of the customer expectations, talking about expectations, or against of the customer goal for the journey. So then, to be able to position ourselves to understand how well we deliver value to customers. Second element is to bring and effectively work with qualitative feedback, which pharma didn't like, due to the adverse events, etc. Because qualitative feedback is gold. It allows us to understand what and why behind the customer perception of the experience. And the last but not least, technology and processes, as I mentioned, to act on customer feedback, which includes right triggers, NBA's workflows, effectively sharing the customer understanding within the organization with the right teams at the right time to build awareness on the experience, but also drive CX improvements. And finally, to monitor closing the loop on the feedback. And I would be curious to, to hear, to see how many of you guys monitor this metric, like in how many cases your teams close the loop on the customer feedback. Can you raise your hand if you have this? Bravo, just three persons, 4. So, and if you don't monitor, and how many cases we actually, close the loop on the feedback, solve the problems of individual customers, then, we have a problem, I think.
Yeah. To build on what you just mentioned, it's exactly this balance between the quantitative and qualitative. And for me, the qualitative is a lot more important because it's great to have let's use the NPS. You have a fantastic score, but you should know why.
Exactly.
Where is this coming from? And how do you leverage that through the whole organization? And what do you give back to the customers? Because it's what you said, and it's coming back to the famous word, iteration. How do you improve this? And it's a very dynamic thing, so that's where technology needs to play its role. But I agree with you, I think too often we are happy, okay, we did a survey, we got feedback, we have a good rating, we're going to publish it all over the place. But if you ask them, hey, but do you know what are the drivers? Often the answer is no. So, yeah.
Arantxa?
And then to build on that, I think a big aha moment, for example, for me in my journey was when you ask the customer, we love them, but they might lie. So how can you pair that with genuine unconscious feedback, right? So for me, it's really important, again, to get behavioral, metrics versus purely proactively provided metrics, and see where's the gap there, right? Because that will give you a lot of information on where things went south. Because again, sometimes we understand there's probably some not perfect correlations between what they say and then how they act, right? So for me, that's also been, I'm super aligned with what you said, but for me, that's critical, which is get different sources, both conscious and unconscious, because there might be disconnects that explain many things, right?
Yeah, I think for me, a bit different approach, I would say, because I do believe data is good and we need insights and we need to figure out what works and what doesn't work. But also from an organizational deployment point of view, try and keep it simple, right? I mean, we have so much data and we have so much information, but if we cannot articulate maybe just 3 KPIs that we're going to measure on a digital project, then it's not going to work when we deploy it to our field teams, to show it to senior leadership. So it's not simple to only get to maybe just a handful of KPIs that will move the needle. But I think it's needed if you want to drive this ability to communicate in a simple manner what works and what doesn't work. So I think another learning from me is to keep it simple. That's really how I see this as well. Yeah.
Haider?
We don't have time for long, so I need to be quicker. So, I'm an entrepreneur, I'm a businessman. And I fall in this industry with people asking me to make money with tech, building microservices beyond, before, after the pill, right? So I was asked, can we create experiences that are going to provide value so that we sell more pills? It's not something you can say if you're in pharma. I can say it, I'm not there anymore, right? But at the end, providing value is also shipping those products to the market so that we help. That's what I mean. So there is a fundamental, we're coming back to the analytic, there is a fundamental aspect of a flywheel or a funnel that on digital, those customer experiences asks us to do, right? So we need to think to see the world with a funnel or flywheel that scale. It means that at some point, either we have a good acquisition tactic, so the experience comes from consideration, right? Am I considering clicking on that ad? Or actually subscribing, opting in, right? So experience starts there, and we forget that it's not on the landing page that it starts, but it's beyond. And then you have a landing page or conversion point that usually is a moment of truth, right? Am I relevant? We talked about context, am I relevant? And third, how do I retain those people? And this is where in healthcare we have this notion now of microservice. And with digital health, I think you were touching on your presentation. You have new services that can retain, like an e-banking in a bank, right? Yep. You're going to come back every day. And those digital health startups are tools in your toolbox from a customer experience to retain more people from an HCP or an HCP to direct to patient perspective. I just open up things that will help, I think, the analytics of your customer analytics scorecard, right?
Tremendously.
Absolutely. Yeah. Let's pick 1 or 2 questions from the audience. Super quick, per question, 6 words, please. I thought about you then.
I'll be as quick as I can. So I was just basically interested in, you talked a lot about different companies to aspire to, like you talked about Amazon, maybe is not the best example, but there are other companies that do not focus on their product as their marketing and lead generation tactics. Good example might be Lego, for example, but one that might be more relevant and related to what Haider said around flywheels would be something like HubSpot. There's a company that produces content that is for training, for education, provides insights, they have meetings, nothing to do with the product. That's how they generate their leads, and they only engage with customers once they know that they are ready to purchase. And those customers now have a great trust in the brand because they've engaged with all this content, and when they're looking for information, they will then go to this company. So I'm wondering, for me, HubSpot is a really good one, and software as a service, a good example of models to follow in pharma because the audiences are similar, very busy. But I'm wondering if you guys have any of your own examples of models and industries that you aspire to try to replicate or to seek inspiration from.
Yeah, go ahead. I talk a lot anyway.
Everyone is looking at everyone.
No, so I think what you're saying, what I like hearing, is that concept of inbound marketing, right? So that instead of pushing like the industry is doing, what can we do as an industry here to actually attract naturally the people, because we have a 10x better experience. It could be non-digital experience, but that kind of is a reality. Am I having a 10x better experience? I'm giving an example just to illustrate. If you are at Novo Nordisk, I liked walking a few years back, you know. I created a portal called Novo Medlink. If you Google it, it's still live, I guess. And what was interesting is the students in Zurich, in the hospital and so on, if they needed to prepare their score, the best resource material portal was Novo Medlink. And I'm not advertising, actually I do have shares, so it's maybe not a good, but it's basically the concept of creating something so useful that naturally you go there. And these are future doctors, so I thought it's very smart from a company to create that inbound pool, so that in 10 years, those guys are becoming endocrinologists, and you know, guess what? They're going to have a positive experience.
And I think definitely, like, I like the angle from services. For me, also services will become more important, and it will become even more important and credible if it's going across companies. And that's, you see some also there baby steps happening, because that's creating credibility, because it's going beyond your own company, beyond your own brands, and it's really focusing on a more holistic experience for the patient in that case.
Exactly.
So, yeah, definitely a route to further explore.
No, nice. I like the hotspot example because it's really a good, you know, like a standard of how they've done inbound marketing incredibly well. I think for us, it's about making choices. So now I'm in an industry, not completely pharma, but like somewhere in between, because like we're also a little bit FMCG. So our ROI is probably not as high as some of you guys here, but what we do need to do is make really, really difficult choices when it comes to where we put our promotional investment, right? So I think for us, the ability to pinpoint what drives demand and how we're going to make money out of each investment we're putting into promotion is going to be very important, and that's what we need to look at is inbound marketing, you know, push strategy. How are we getting most out of our investment is how we're going to look at it. But like, I love the hotspot example. I think it's super cool what they're doing and what they've been able to do. But like, also long term, short term, when do we need the revenues to come in? What do we invest in long term?
They have VC money to do it. That's also. That's also I'm just saying it's easy not to fail when you have like 1 billion of advertising budget, right? I'm just going to put it in context.
Perfect.
No, for me, just building into Dirk's point, I think we're so used to deploying competitive strategies, right? When we think of product promotion, a quick mindset shift services should be about collaboration, not competition, right? So pretty much, you know, subscribing what Dirk said. Yeah.
And maybe the final point here is about value. From my perspective, if what we provide to customers gives them value add, then obviously they will be returning, they will be sharing with other colleagues. So I think to understand, you know, thinking of the customer, their needs, and then providing value to them, I think it's crucial. Yesterday we had a presentation, someone mentioned that, or maybe it was the chat during the coffee break, someone mentioned, yeah, for our customers, they know already our brands. The brand is established on the market for ages. They know the brand, they know the product, etc. So what we provide to them is actually additional services like education, how to best communicate with the patients, you know, how to overcome burnout, etc. So this is the value for customers. Why don't we, you know, expand beyond our product view or brand view and give it to customers if there is a need for that?
Thank you, Ksenia. With that thoughts, I would like to finish. Thank you so much for joining, and well-deserved coffee break.
Thank you.
Thank you.
All fine.